we'll be talking about Alzheimer's disease. So, what is Alzheimer's exactly? Alzheimer's is a chronic progressive neurodegenerative disorder characterized by three primary groups of symptoms: cognitive dysfunction, which includes memory loss, language difficulties, and executive dysfunction; psychiatric symptoms and behavioral disturbances, which include depression, hallucinations, delusions, and agitation; and the last one, which is probably the most obvious one, difficulties with performing daily activities. So people suffering with Alzheimer's can be seen to struggle with things that were probably relatively easy before. So like eating or dressing yourself in the morning. The average age of the first symptoms are seen at around 60 to 65 years old. However, the diagnosis age is usually 80 years old. So this shows how much of a progressive disease this is. Although the symptoms show up at around 60, 65, the diagnosis is not given until about 15 years later. Another form of it is early onset Alzheimer's disease, which is very rare. So, if there are 4 million Americans with Alzheimer's, about 200,000 of them will have early onset, which is about 5%. Dementia is a big part of Alzheimer's disease, as it is not a specific disease itself, but it is the impairment of two brain functions, such as memory loss and judgment. So, if memory loss and judgment were both impaired, you would be said to have dementia. Symptoms include forgetfulness, limited social skills, and thinking abilities. Things such as in this image, you can see the old lady is struggling to recognize her family members. And 60 to 70% of dementia cases are caused by Alzheimer's. So they're not always caused by Alzheimer's, but there is a direct link between Alzheimer's and dementia. There is no known cure for Alzheimer's, as even though it has been studied for decades, there still hasn't been a breakthrough in terms of a cure. However, there has been pathological findings that have allowed us to understand the disease a little bit more. These findings include amyloid plaques, neurofibrillary tangles. Um, it is not known which one occurs early in the disease process, so their role in the etiology is still controversial. This is something that is still argued to this very day. So, in a healthy neuron, you would expect. So, what neurons do in a body actually, neurons allow the transmission of signals throughout the entire body. This includes information, memory, and even motor functioning. So, when there is a problem with neurons transmitting signals, there's going to be a big problem with the health of the human being involved. This is where Alzheimer's comes in because Alzheimer's has been seen to interrupt these neuronal connections by with tangles and plaque, so it doesn't allow the information between neurons to transmit as fluid as it would without those plaques and tangles. So, what exactly causes those plaques and tangles? So the one hypothesis that scientists have come up with is known as the amyloid cascade hypothesis. And basically, what it is describing is the formation of these amyloid plaques. Um, so, processing of amyloid protein precursors can occur via two pathways: cleavage within amyloid beta precursors by the secretase, which generates peptide products that do not precipitate to form amyloid, which is healthy, or cleavage in the endosomal lysosomal compartment, resulting in intact amyloid beta precursors that precipitate to form amyloid, and in turn causing neurofibrillary tangles and cell death or apoptosis, the hallmarks of Alzheimer's disease. So essentially, these amyloid precursor proteins create these amyloid beta, which clunk up on the extracellular side of the extracellular side, and uh, they are toxic and cause synaptic dysfunction and neuronal cell death. Right. So what ends up happening is what we see here. You get a lot of tangles between the neurons where the neurons should be. You get diseased neurons that undergo a programmed cell death known as apoptosis, and you get plaques that do not enable the neurons to send signals between each other to keep the body healthy and transmitting information in the proper way. Finally, even though there is no cure, there is treatment, as seen on this website for Alzheimer's. There is a way to stop. There's no way to stop or slow its progression, as it is a progressive disease and a very effective one in this sense. But there are drug and non-drug options that will help treat symptoms. So, for example, there is a cholinesterase medication, a cholinesterase inhibitor uh, medication that prevents the breakdown of acetylcholine, which is a chemical important for learning and memory. So, this cholinesterase inhibitor uh, prevents the breakdown of acetylcholine. So, this is just one example of a medication that has helped deal with the symptoms of the disease rather than attempt to cure it, because we have not found a way to do that yet. And that is all. Thank you. Run that back, turbo. You can get the biggest Chanel back in the store if you want it.